Hey, welcome back. In this segment, we're going to talk just briefly about a little history of hormones. It'll be quick, but you need to hear this so you understand why we are where we are. For centuries, women have searched for relief from the ravages of menopause: incessant hot flashes, drenching night sweats, unexplained anxiety, tossing and turning from insomnia, vaginal dryness, and a decisive disinterest in sex. It's hard to describe to someone who hasn't gone through it just how debilitating it is to nearly completely lose your hormones. I readily concede that I'm not worthy to presume to understand the extent of suffering that a woman feels in this state. Let's just say it's depressing, sad, maddening, and physically miserable all at the same time. Men, don't even begin to think you might know how this feels. We would shrink to a fetal position and cry like babies. This is a major condition of human suffering. So imagine the excitement when, beginning in the 1940s, pharmaceutical companies figured out we could give estrogen back to women in a pill form as they lost the ability to produce it for themselves, either at menopause or after a full hysterectomy. It was called Premarin that they came up with, and it really took off with the 1966 publication of Wilson's book, Feminine Forever. It was a bestseller that made the assertion that menopause is a hormone deficiency disease, curable and totally preventable. Just take estrogen. The world was happy again because Mama was happy for a while. A few years later, in the early 70s, these women started turning up with cancer in the uterus. We learned that taking estrogen alone without progesterone, as the body does it in a woman's cycle, leads to overstimulation of the uterus and can eventually cause cancer. So, hormones are bad. Everybody stop taking them. Then the drug companies came up with a form of progesterone they could patent. They called it Provera. And this controlled the uterine cancer, and so everybody was happy again. For a while. Fast forward about 40 years. In 2002, a major international study called the Women's Health Initiative was stopped early for ethical reasons. It was a study of women on the altered man-made hormone combination of Premarin, estrogen sourced from horse urine, and Provera, a variation of human progesterone modified so they could patent it. It turns out women taking these drugs experienced a significant increase in breast cancer, heart disease, and stroke. It's pretty scary that it took more than 40 years to identify adverse effects that are that serious. It's a lot of drug company profits. So now again, hormones are bad, but it gets worse. The press and the medical community then mistakenly applied those results from that study to all hormones, including the actual human hormones estradiol and progesterone, native human hormones that I was dispensing, BHRT we call it, which your own body makes, that have a structure and downstream metabolites that are very different from Premarin and Provera. Well, this threw women's health into chaos. Again, doctors everywhere cut women off all hormone prescriptions. And that's pretty much where the mainstream media left it. A cruel half-truth that has persisted to this day, leaving women to bully their way through menopause alone, thinking the only alternative to hormones was an early death. Ironically, and it's a terrible irony, those bioidentical hormones, estradiol and progesterone, actually protect against breast cancer, heart disease, and stroke. The very things using Premarin and Provera was stopped early for. So if you've heard that hormones are harmful and can cause cancer, this is where those rumors came from. Sadly, it's a misinterpretation and misinformation not supported anywhere by studies, and it blows me away that these rumors persist nearly 20 years later. The reasons they persist are shameful. No doubt they've cost billions of dollars in healthcare costs. You'll see how later in the course. I could give you several other examples, but looking back on my 30 years in pharmacy, I've just learned to carry a healthy skepticism when dealing with our medical pharmaceutical complex in the US. It's a massive behemoth that's anything but nimble. It wants to keep going in the direction it's going and turn slowly like an ocean liner. That's the law of momentum. That's status quo. That's easy. Do not assume your current practitioner's knowledge of hormone therapy is current. If something doesn't sound right or you don't understand, ask for the proof. Ask for more information. If they can't or won't give it to you, delay your actions and your decisions until you get it. You may have to find a new doctor. And there's no disrespect intended there. General practitioners or family practice doctors have a lot on their plate. They have a lot to manage, and hormones are a specialized area. There's nothing wrong with a doctor saying, that's not an area of medicine I'm familiar with, and I just don't feel comfortable managing that for you. Some of the wisest words to come out of the mouth of a doctor are, I don't know, but I'll find out. I have a high respect for that doctor. Just always remember, you are the medical director of your body and the bodies of the children or anyone else that depends on you for protection. We medical people are just advisors. Where your skin starts is the border of sovereign territory. Nobody gets past that without your consent. In this day and age, you cannot afford to be passive about medical care. The information is out there. Misinformation is out there too. Get your subject matter expert for the issue at hand and check everything you hear against that. Your current doctor may be that trusted source. That's awesome. But there's no shame if he or she is not. Who knows? Maybe you'll be the one to prompt her or him to update some aspect of their knowledge. It happens regularly with me and my patients. That's why they trust me. So, be careful who you trust. You're in charge. Let's do this.